Hello, everybody. This is Charles Williams. I'm here with my son, Jordan. This is my script writing assignment. So I had a patient. His name was Michael Smith. He was a 21-year-old who was admitted to the hospital with asthma, starting having trouble breathing about 3 days ago when he was visiting a friend of his who had cats. So upon assessment, he was wheezing bilaterally. We checked his peak flow. It was about 306, which was 50% of his predicted value. So we went ahead and we did asthma education. We explained exactly what an asthma flare-up was, how it involves inflammation, bronchoconstriction, extra mucus production. We talked about all of the different potential triggers out there. We talked about asthma medications, albuterol, which is your fast-acting medication. And then we talked about steroids and controller medications and which ones are for maintenance and control. So what we're going to do is kind of fast forward a little bit in the asthma education portion. So Michael, right now we're going to go over how to use your inhaler with a spacer. We always recommend that you use your inhaler with a spacer. This will actually help you get more medicine from the inhaler when you use it with a spacer. Okay, so we're going to go through it step by step. So you always want to take your inhaler, and before you begin, you always shake it up very well. These inhalers have a propellant that helps the medication shoot out, so you always want to mix them together. You're going to attach the inhaler to the back of the spacer. You're going to breathe all of the air out of your lungs first. Then you place the mouthpiece into your mouth, creating a nice tight seal. Press the inhaler down once to release the medication. Then you're going to breathe in slowly and deeply. Be sure to hold your breath for about 5 to 10 seconds. Then you want to wait usually about 30 seconds to a minute before you do a second puff. So here's an inhaler that doesn't contain any medication. This is something that we use just for practicing. So I want you to do it a few times so that you feel comfortable doing it on your own.
Okay, I'll try a few times with spicy.
All right, great job. You have a really good technique. Okay, so next I want to talk to you about something called a peak flow meter. So a peak flow meter is something that a person with asthma can use to help determine how well they're breathing that day. Peak flow meter measures how fast you can blow the air out of your lungs. Okay, so I'll go through it step by step, and then I'll have you try it for yourself. So the first thing you want to do is you're going to set the meter to 0. And make sure you
Mm-hmm.
stand in an upright position. You're going to take a big deep breath in, hold it, and then blast it out as fast as you possibly can. And then I want you to record whatever your meter reading is. Okay? So now you're going to try it a few times. Okay, very good. So remember, you should be able to blow about 80% of your predicted value. So what we're going to do is we're going to calculate where your predicted value should be and establish a green zone, a yellow zone, and a red zone on your asthma action plan on the peak flow meter. So these numbers will be on the action plan, and I will go over that with you before we're done, okay?
Okay, thanks.
Okay, so here's an asthma action plan, okay? So the asthma action plan contains a green zone, yellow zone, and red zone to assess the severity of your asthma flare-up, okay? So it depends on either symptoms or what your peak flow readings are. And that determines which plan you want to follow. So if you're feeling good, you don't have any symptoms such as coughing, wheezing, shortness of breath, and your peak flow numbers are 80% or higher, that puts you in the green zone, and you're just going to follow the plan here to the right according with the green zone plan, okay? So if you still feel pretty good, you don't have any symptoms, but yet your peak flow reading is 50 to 80% of your predicted value, then you would put yourself down into the yellow zone, okay? So the opposite of that is true as well. So peak flow numbers are okay, but yet you do notice asthma symptoms, you would put yourself into the yellow zone based upon those symptoms, okay? So it's either symptoms being present or what your personal peak flow number is, okay? So if your peak flow is 50% or less, that would be a medical emergency, and put yourself into the red zone and follow the plan associated with that, okay? Any questions so far?
Okay. Thank you so much, Charles.
Okay, so finally, a couple important things to remember. You want to call your doctor or get to the emergency room if symptoms get worse, even after you take extra medication, having a hard time breathing, or your peak flow has dropped below 50%, struggling to walk or to talk, or you notice that your lips or fingernails are turning a different color. That probably means you're not getting enough oxygen, okay? So I know that was a lot of information. And I think we covered the key components to keep your asthma under control. So remember, asthma can be life-threatening. You know, people die every day from asthma. So monitor it closely and don't hesitate to call us if you have any questions or concerns, okay?
Okay. Thank you so much, Charles. That was very helpful.
All right. Thanks, everybody.